Hi, my name is Vin Calatavidal. I'm joined by Professor Beverley Hunt, OBE, who is the chair of the World Thrombosis Day Steering Committee. Welcome, Beverley.
Thank you.
Tell us about your role as World Thrombosis Day chair.
It's fairly amazing because we have this amazing program that's been going for over 5 years now, aiming to increase awareness of thrombosis across the world, both for health professionals and the general public, and also to try eventually to improve care of people who have thrombosis. And it took off in such an amazing way. So I think last year we had about 15 billion impressions on social media when we had our campaigning on World Thrombosis Day. And so we've got all this awareness, but we also are approaching the World Health Organization to get them to think more about thrombosis and improve care and reduce mortality from thrombosis as well.
Why is World Thrombosis Day important to you and the ISTH?
It's important to me because I started campaigning to improve care back in my home country at home in the United Kingdom. I started a charity, it's now called Thrombosis UK, and we campaigned to improve care by demanding that our government introduced VT risk assessment in hospitals. Because when we look at venous thromboembolism, 60% is due to hospital admission, and if we give effective thromboprophylaxis, we can reduce the number of VTE and also the death rate. And we finally got this instituted in 2010, and the death rate due to pulmonary embolism has dropped by about 9% in NHS England as a result of that. So it's a real success story, and we want to take this out globally, and World Thrombosis Day is keen to do that too, so we can take out this very effective way of reducing mortality to the WHO and to other countries.
So how does World Thrombosis Day's mission align with your professional work?
Well, I'm a doctor who deals with thrombotic problems 80% of my time, so in caring for my patients I'm totally aligned with World Thrombosis Day, and in some ways working with them is much more powerful because we're hitting so many more people. So I very much value the one-to-one contact with a patient, but we can influence so many more people by working through this campaign.
As a clinician, how do you educate your patients about thrombosis?
So every time you meet a patient, every time you meet another healthcare professional, it's an educational opportunity. So chatting with the patient, talking about their signs and symptoms, and if they stop anticoagulation, we know sometimes they've got an increased risk of having another thrombotic event, just reminding them about the signs and symptoms, talking to them about the drugs that they're taking, mainly anticoagulants, and talking about the possible side effects and how to recognize them.
Since you've been involved in the World Thrombosis Day campaign, have you seen an increase in the awareness of your patients and your fellow healthcare professionals?
So I think that's coming because it's that constant drip of information across the world that will gradually raise the information. In England, we know we've had an effect because we did a Mori poll across the world of the public's knowledge about venous thromboembolism, and in the UK it was much higher than anywhere else. About 80% of people know what a deep vein thrombosis is and roughly know what a pulmonary embolism is, where it's only about 20 or 40% in the rest of the world. So we're a little bit ahead, but we're waiting for everyone else to catch up.
What's your advice for someone who's interested in getting involved with World Thrombosis Day?
We'd love to have you on board, and please would you contact our office. You can do that by looking at the website. That's www.worldthrombosisday.org.
Thank you, Professor Hunt. And once again, thank you very much for your time.